Hi, I will be talking about the disease of leptospirosis. What is leptospirosis? Leptospirosis is a disease that is caused by an infection from a bacteria known as Leptospira. Leptospirosis taxonomy is family Leptospiraceae, phylum Spirochetes, and then genus Leptospira. The morphology of Leptospira is a gram-negative, tightly coiled aerobic spirochete with two periplasmic flagella. There are about 35 different species of Leptospira and 90 different strains that are separated into numerous sevivores that are found worldwide. What is the history of leptospirosis? It actually is known as Wills disease, and it was thought that it originated in Asia. In 1886, Adolf Well, the professor of medicine in Heidelberg University, he began to write the history of leptospirosis. He actually described 4 cases of an acute febrile illness characterized by jaundice, abnormal signs in the central nervous system, and renal malfunction. Then in 1887, the term Wells disease was coined. And in 1917, Hidego Noguchi, a Japanese bacteriologist, created the genus Leptospira. Leptospira is actually divided into 2 groups of species, Leptospira interrogans and Leptospira biflexa. Leptospira interrogans is comprised with all pathogenic strains. There have been at least 200 different serotypes that have been identified for the species of Leptospira interrogans. In the United States, the most important serotypes have been Canicola, Gripo, Tifosa, Hartsjo, Itherial, Hemorrhagia, and Pulmona. Leptospira biflexa, on the other hand, is a non-pathogenic bacterium that contains saprophytic strains isolated from the environment. Recently, there have been new analyses that showed that the genus Leptospira is divided into 3 groups: saprophytic, intermediate, and pathogenic. The species of Leptospira have different ecological niches to the diversity of mechanisms. The species of Leptospira uses signal transduction to help them adapt to different hosts in harsh climates, which help the species survive the environment they are in. The cellular structure of leptospirosis causes them to be susceptible to killing by adverse conditions such as dehydration, exposure to detergents, and temperatures above 50 degrees Celsius. Most cases occur during the summer and then the fall. Transmission. Leptospirosis is a zoonotic disease that is transmitted from animals to humans, affecting both species. There have been rare cases of leptospirosis being transmitted from person to person. Leptospirosis is spread through the urine of an infected animal, meaning that the animals excrete the bacteria through the urine. The bacteria can be found in water or soil and can survive in these types of environments for weeks to months. A range of species can potentially carry the bacterium, including cattle, pigs, horses, dogs, and rodents, especially wild animals. The infected animal can continue excreting the bacteria in the environment continuously or occasionally for a few months or up to several years. In this picture, we have the leptospirosis transmission cycle. We start with the rodent carriers. They secrete the bacteria. They contaminate the water and soil. Then humans get infected. Risk factors being water sports, fishing, swimming, and rice farming. Then we have the mammalian reservoirs. They actually also get infected here. They excrete the bacteria through your urine and then contaminate water and soil. And then if humans get infected, risk factors being contact with animals, butchering, hunting, and farming. And who is at risk? Dogs are the most common species to be infected with leptospirosis. Humans and dogs can become infected through contact of urine of the body fluids, except for saliva. From animals, or they can come in contact with water that's contaminated. For example, if a person or dog drinks water from a lake or a river. Soil as well, or contaminated food, such as infected tissues or carcasses that have been infected with urine. The bacteria can also enter the body through the skin, particularly if the skin has been broken. So for example, if you have a cut in your hand and it's an open wound, that the bacteria can enter through that possible wound, okay? Then in most cases, dogs are infected through a bite from an infected animal. In rare cases, dogs are infected through breeding. However, the mother can pass the disease through the placenta. Signs and symptoms in humans. Um, there's a variety of symptoms and signs in humans. There are times that humans do not show any type of symptoms, and then the symptoms are high fever, headaches, chills, muscle aches, vomiting, jaundice, yellow skin and eyes, red eyes, abdominal pain, diarrhea, and rash. In this picture, you can see the yellow in the skin, and then you can see kind of see a little bit of the yellow in the skin too. Of course, yellow of the eyes, and then redness here on the eyes as well. Then for a person to be infected, a person must be exposed with a contaminated source and become sick within 2 days to 4 weeks. A person can go through different phases. In the first phase here, a person can have fever, chills, headaches, muscle aches, vomiting, or diarrhea. In the second phase, it's more severe, and it can lead for a person in having a kidney or liver failure, serious development in the lining of the brain, or meningitis. Leptospirosis can also cause death if not treated. The disease lasts for a few days to 3 weeks or even longer. A person needs to have treatment in order to recover. If not, the recovery can take several months. Signs in dogs. In dogs, the signs and symptoms vary for leptospirosis. Like humans, there are dogs that do not show any signs and symptoms. And the dogs, and there's sometimes that dogs do not show none of them, but when they do, the symptoms are fever, shivering, muscle sensitivity, unwillingness to move, increased thirst, changes in the regulatory or amount of urination, dehydration, vomiting, diarrhea, loss of appetite, lethargy, jaundice, yellow skin and eyes, or painful inflammation within the eyes. This picture actually is showing the yellowness in the dogs that it could cause. And then there are actually that severe causes that develop in dogs. For example, bleeding disorders, lung disease, difficulty in breathing, kidney failure or liver failure, swollen legs, or excess fluid that accumulates in the chest or abdomen. Exposure of the bacteria and the development of the disease is about 5 to 14 days, but in some cases it may take up to 30 days or even longer. Treatment in humans and dogs. In humans, leptospirosis can be treated with antibiotics, penicillin, and doxycycline. That antibiotics work best when given early of the disease. Depending on the severity of the disease, patient may need intravenous antibiotics. Then in dogs, leptospirosis can be treated with antimicrobials. First choice is penicillin or doxycycline. Treatment in dogs should be addressed immediately before any major complications such as kidney or liver failure occur. Depending on the severity of the disease, some dogs may need dialysis or hydration therapy. Prevention in humans. Unfortunately, there's no vaccine for humans. That is why prevention needs to be taken with precaution. People can avoid being in contact with water that may be contaminated, reducing swimming and splashing in waters, especially in fresh waters such as lakes and rivers. If people must be in waters that may be contaminated because of work or any other activities, one should wear protective clothing and footwear to prevent exposure. People should avoid touching fresh waters and then as well avoid touching the soil that may be contaminated with animal urine. Make sure to wear gloves if handling an object that was contaminated with urine of the animal. People can reduce being in contact with infected animals, and then people should also make sure to drink water that it is clean, or water can be treated for consumption by boiling it or using proper chemicals such as iodine tablets or water filters as well. And then prevention in dogs. There's actually a vaccination that's very effective for preventing against disease and mortality caused by 4 virtual leptospirals That vaccination is called Lepto4 vaccine. The leptospirals that it protects against is Leptospira canicula, Leptospira icteriohemorrhagia, Leptospira pulmona, and Leptospira gripotyphosa. The vaccine protects the dogs for 12 months, and an annual vaccine is recommended. Several precautions that can be taken to prevent and reduce exposure to dogs also is if a dog can be exposed to leptospirosis, administration of antimicrobials as instructed by the veterinarian should occur. Until the veterinarian says to stop, the dog needs to continue with those medications. And then humans should avoid the dog's urine. Quickly clean the area that the dog urinated on with household disinfectants, and gloves should be worn to protect the skin from contact. Dogs shouldn't urinate near high traffic areas that people have access to, and people should maintain good hygiene by washing hands after handling their pets. Thank you so much for watching my video, and hope you have a wonderful day.